Hi friends, before starting with the lecture, I would like to thank each one of you for supporting my channel and for such a positive response. Please keep subscribing me after each and every video. Press bell icon button, give your likes and send your comments too. One thing I want to clarify is that subscribing the channel doesn't cost a single penny to you. Only the aim behind it is that when I will make new video, you will get notification about that video, so it will be easier for me to keep in touch with you. Now let's start with our second topic, that is intravenous fluids. Before starting with the session, let me ask you three questions. First one is, why resins get swell after keeping in water overnight? Second question is, after taking bath, why you are unable to put your daily ring in your finger? And my third question is, after coming out from beach water, why your skin get dry? So answers are given in the session. So let's watch the session. It is related with IV fluid. So as I told you in first my topic, that when we are learning with new topic, first we have to clear our basic. So it will be easier for us to understand the next topic. So as we know, our human body is 60% water. Where that water is present, intracellularly, extracellular, interstitial fluid and lots so. So how this body uses this water? So what are the functions related with this water? Body is regulating our body, water is regulating our body temperature. It is helpful in lubricating joints. It is helpful in carrying oxygen and nutrients to the cell. It is helpful to throw out waste product out of the body. It is helpful to dissolve different types of minerals and nutrients in it. Then which are the reasons due to that fluid loss can occur? Maybe due to blood loss. Blood loss takes place due to various reasons. For example, in accident patients, during surgery, in gynecological reasons. Also hemorrhage may be occurred. Even if patients came with complaint of vomiting, diarrhea, dehydration, electrolyte imbalance can occur, and these are some of the reasons related with fluid loss. So which effects we can see, or how it can affect the body? So electrolyte imbalance can occur, then body get stressed, too much stressed. Due to that, brain function can be impaired, cognitive function can be impaired. With that, blood becomes concentrated. So what happens when blood gets concentrated? It gives signal to the kidneys to retain water, and due to that the urine output also get decreased. Also the blood gets thicker and it puts hard work on it puts pressure on the heart, and then heart has to work harder. In this case, the pulse rate of the patient increases because the body has to maintain the blood pressure. These are some effects on our body, and how what is the solution on that? Replacement of IV fluid resolves these imbalances and it restores our normal body function. So now you understood how much important fluid is in our body. Now we have to deal with two more concepts. First one is solution and second one is osmosis. And these two concepts we have to fix in our mind, because when we are going to see about IV fluid, then these concepts will be helpful for us to understand about exactly what reactions are taking place and why we have to administer the specific type of IV fluid. So let's concentrate on this. What is solution? Very simple. Just take one example. I take a bowl of water that is called solvent. And I add solute in that. Solute, for example, salt. So I take a bowl of water and put 1 teaspoonful of salt. When I mixed it, then it is called solution. So mixture of solvent with solvent and solute is called solution. Many times we are calling it as a intravenous solution, because we are taking solvent, that is water, and then we are adding different electrolytes in that, so it is making that specific IV solution. Understood everyone? So the concept is clear. Now just move on to osmosis. What is osmosis? When fluid flows from lower concentration to higher concentration through semi-permeable membrane, then it is called osmosis. Now if I will take a bowl of water, then that is a plain water, it is not concentrated one. But when I will add sugar in that, or I will add salt in that, then definitely it will get concentrated. And how much electrolytes you are added, and how much electrolytes you are added, it makes that solution more and more concentrated. So just see one figure to understand osmosis. See, I have taken one U-size tube and I put semi-permeable membrane. What is semi-permeable membrane? Semi-permeable membrane is having small pores in that, so can fluid flows out of that. So our cell is also made up of, our cell membrane is also having semi-permeable, that is semi-permeable membrane. So fluid can go inside the cell, even come out of the cell if the molecules are smaller, like crystalloids. So I have taken one U-size tube and I have added simple plain water, that is solvent. So you can see equilibrium to both sides is same. But now I just add salt in that. So it is a solute. Now you can see right side's concentration increased. So afterward what will happen, after half an hour, after 1 hour, when you will see that U-size tube, then you can see this water level got decrease, it will get decreased, and this water level will get increase. Why this happened? Due to osmosis reaction, because fluid flows from lower concentration to higher concentration. So I ask you 3 questions at the beginning of this session, and in that first question was related with resins. So see again with diagram, try to understand it. I take a bowl of plain drinking water and put one resin in that, but the concentration is in resin is more compared with this plain drinking water. So where fluid will flow, fluid will move from less concentration to more concentration. So this fluid will go into the resin, and in the morning when you will see this resin, then it will get swell up. So I think both the concepts are clear. So let's move on to our main topic, that is IV fluid types. There are total 3 types of IV fluid. First one is colloids, second one is crystalloids, and third one is blood product. But today we are not going to learn about blood product, because this is a vast topic. I am going to make another video on specifically on blood product. So let's see about colloids and crystalloids. In our wards, mostly we are using crystalloids. 90% we are using crystalloids, hardly 10% we are using colloids. What is the difference in colloids and crystalloids? Crystalloids are having larger molecules, so they cannot cross semi-permeable membrane, and crystalloids are having smaller molecules, so they can cross semi-permeable membrane. Colloids are costlier compared with crystalloids. Crystalloids are cheaper. So when colloids are we are using in the wards, they are using as a volume expander for volume expansion, and they are increasing intravascular space. Also they are helpful in raising BP. Also they are indicated for patients who are in malnourished state. Also we are giving colloids to patients who cannot tolerate large infusion at a time. So there are three types. These are coming under colloids, not exactly types, coming under colloids. Human albumin, which comes in 5% and 25%. So human albumin is derived from plasma, and they are restoring protein levels in burns patient and in patients with trauma. Then next one is Dextran. Dextran is useful to treat hypovolemia. As you know, hypovolemia is decreased volume of circulating plasma due to burns or maybe in surgery patients. And third one is PPF, that is plasma protein fraction. This is also derived from plasma, and it is infused slowly because it is increasing circulating volume. So I think colloid is clear. Now concentrate on crystalloids. There are three types of crystalloids: isotonic, hypotonic and hypertonic. These IV fluids we are using in our day-to-day work. So please put your attention over here. What is concept of isotonic? I have taken one pot and put fluid which is having same concentration compared with our RBC, and then I put one RBC in that. Now where the fluid will flow? As we learned in osmosis, fluid flows from less concentration to more concentration. But here concentration in the cell and concentration of fluid both are same. That's why the fluid will go inside the cell and also will come out of the cell. So when you will take out this RBC and will see, its size can't change. It will remain in a same size. And the examples of isotonic are, first one is 0.9% NaCl, which is also called as normal saline or sodium chloride. It contains 154 milli-equivalent per liter sodium, and chloride also 154 milli-equivalent per liter. So it contains sodium and chloride. Where we are using normal saline, if patient come with complaint of vomiting, diarrhea, dehydration, hemorrhage, then we are preferring 0.9% NaCl. We are using it as a flush, to flush the line so it gets clear. Also we are using, this is the only one solution we are using at the time of blood transfusion or in between blood transfusion. Only the thing which we have to be cautious about is that when we are giving sodium chloride, it contains sodium. So the patients with heart disease and patients with kidney disease, we have to keep a close watch on those patients. Now second one is Ringer's lactate. So Ringer's lactate contains 5 electrolytes. Which are those? Sodium, potassium, chloride, magnesium, calcium and lactate. So if you will compare Ringer's lactate with 0.9% NaCl, then Ringer's lactate is having more electrolytes and its plasma concentration is matching to human body. Then in which conditions we are preferring RL? It is a fluid of choice in burns patient. Then we can give in acute blood loss patients with hypovolemia. If electrolyte imbalance is there, we can prefer this. It is RL is contraindicated in patients whose pH is more than 7.5, and also if any patient came with complaint of liver disease, then we are not preferring Ringer's lactate, because lactate is metabolizing in liver, and if liver is not functioning well, then lactate cannot be metabolized. Third one is 5% dextrose. As you know, it contains glucose and calories. So we are mostly using 5% dextrose as a maintenance saline. Even patients came with complaint of less blood sugar level, that is hypoglycemia, then we are preferring 5% dextrose. Only precautions we have to take, which precautions we have to take? When we are giving, we have to observe blood sugar level of the patient. So I think isotonic and these three salients you understood well. Now move on to hypotonic. Now again I am going to take one pot. I am going to draw one pot. I am putting some fluid in that and putting one RBC in that. Now let me tell you, the concentration of this RBC is more and this fluid is not having that much concentrated. So where the fluid will flow according to osmosis, from less concentration to more concentration. So again the fluid will flow from fluid site into the cell. So when you will take out that cell, you can see that swell will get swollen. The examples of hypotonic solution, before seeing that, I had asked you in the beginning of the session one question. The question was, you just have to do this practical in your home, that you have to remove your ring before going to take bath, and after coming from bathing, when you will try to put that ring, then it will be difficult to put it again. You have to push that ring. Why this thing happened? Because the hypotonic reaction happens there. So if anyone will ask you same question, you have to tell that person it is nothing but a hypotonic reaction. The examples are 0.45% NaCl. So it is also called as half saline because it is having 77 sodium and 77 chloride. So in which patients we are using 0.45% NaCl? In hypovolemia, if the patient is having hypernatremia. Hypernatremia means increased sodium level. In those patients we are preferring it. Second IV fluid is 0.225% NaCl. This fluid we are using as a maintenance fluid in pediatric patient. So clear with hypertonic solution. Let's move on to hypertonic solution. Again take one bowl, put some solution in that and put one RBC in that. But when we will take this RBC out, it will get shrink. Exactly what happens? The fluid which we put, that is a concentrated fluid, and our RBC is not that much concentrated. That's why fluid will flow from less concentration to more concentration. So fluid will flow out of that RBC, and then when you will take out that RBC, it will be, you can see it like shrunken one. I asked you third question in the beginning, and the question was, when you are going on beach, playing in water, enjoying in the water, but when you are coming out of that water, beach water, then you can see a dry skin. Hypertonic reaction takes place. Just imagine the water is sea water, and you know that sea water is too much salty, and our skin or our cells are not having that much electrolytes, so our electrolyte level is less compared with that sea water. So when you are enjoying in that sea water, the water flows from our upper surface of skin towards the sea water. That's why when you come out of the sea, you can see your skin gets dried, and even after some days you can see it gets little bit blackened, because hypertonic reaction happens. Now let's see one example of our medical knowledge. When the patient came with complaint of cerebral edema, then patient cells are brain cells are swollen. But when we are starting with 3% NaCl, which is having too much of sodium and chloride, it contains nearly 513 milliequivalent per liter sodium and 1030 chloride. So you can imagine it is having too much of sodium and chloride. So when we are starting with 3% NaCl in cerebral edema patient, what's happened? The cells are swollen, and when we are starting with this solution, fluid flows from cell side to that fluid side, and that's why slowly the edema gone and gets less, and the cell come to its normal size because the hypertonic reaction takes place. Second example of hypertonic is dextrose 10%. So we are using it in a treatment of ketosis of starvation. Means when a patient is starving for more than 24 hours, then body started sending ketones in the body. At that time we are giving dextrose 10%, and dextrose 50% we are giving in severe hypoglycemic patient. So I think all your doubts got clear and you understood what I teaches you. Only I want to request you one important thing, and that is when you are working in the wards and when you are attaching IV fluid to the patient, before attaching it, just see the compositions of each and every IV fluid, and when the patient will come and you are going to do a case study on that patient, at that time also, before doctor tells you, you just have to tell all your colleagues, doctors, that we have to give this fluid to this patient because these reactions are happen in the patient's case. Now from nursing point of view, we will see some nursing consideration. So first of all, see about hypotonic solution. As you know, if we will give it in a large amount, then the cell can get swollen. It means it can increase intracranial pressure and it can lead to cerebral edema. So be cautious in that. In hypertonic solution, in each and every case, first you have to document the baseline data. In that you have to take patient's vital parameters, then see patient's condition, check patient's output, BP, everything, and if everything is well, then only you have to start with IV fluids. If even if you have to see about hypervolemia, it means if the patient is having swelling on hands, face, legs, if patient's BP increases, then you have to be cautious and you have to keep checking BP of patient. Then you have to verify doctor's order twicely, thricely, and then you have to start with IV fluid. Then about hypertonic specifically, don't administer it peripherally because it is irritating the veins and even it is damaging the blood vessels. Every time you have to assess health history of the patient. And about colloids, what nursing consideration you have to keep it in your mind is that it can cause allergic reactions, so be cautious about that. I hope you understood today's topic. If you want to make me videos on different topics, you can also prefer that. Write down in comment and please don't forget to subscribe. Thank you so much.